And here we go. Time for our weekly update with K3NowMD.com. Good morning to you. I am Pat George, and every Tuesday, Wednesday, and Thursday at this time, we meet with you and give you some information. What we've got to ask you to do right now is especially if you're a guy, we want to help you. So turn the radio up a little bit, because what we're going to talk to you about could change your life. And with us every morning, the expert, Dr. Robert Kowalski. Good morning, Dr. Bob.
Good morning. How you doing?
You don't mind if I call you Dr. Bob, do you?
No, it's perfect.
Okay. There are people that tune in every week and they hear our update, but we've got new listeners. So if you can just touch on a little bit about your background and how you got involved in K3NowMD.com.
Sure. I'm a board-certified neurosurgeon and have a busy neurosurgical practice here in the Tampa Bay area, but one of my hobbies that grew out of my own personal interest in well-being was having a age management and wellness clinic, and that is what K3 Now is. We focus on all aspects of increasing longevity and increasing quality of life. A lot of that centers around the endocrine system. One part of the endocrine system in men is testicular function and testicular production of testosterone, which, again, often fails us as we age, and the effects of low testosterone were sort of well documented and well known, and you can't turn on the radio or TV without hearing about these days. That's one small part of what we do, but obviously a very important part and important to most men.
Well, a lot of the guys out there, they think that testosterone, as far as having a low testosterone balance in your body, is just for your sexual performance, but that's not true. Could you explain how an unbalanced hormone or thyroid causes weight gain and affects the ability for the body to even lose weight?
Well, yeah, that's one of my sort of pet areas of study is, and I think the best way to think about it is your hormones. And again, in men, we have estrogen and testosterone, just like women also have estrogen and testosterone. But I think of those hormones basically set your weight much like a thermostat sets the temperature. And, so if those are out of balance, you could sort of fight it. You could do any, a low-fat diet, low-carb diet, exercise an hour, 2 hours a day. And the analogy would be like pushing a boulder up a hill. You might have some short-term success, but the moment you let up, it's going to reset back to where your endocrine system is its set point. And if your estrogen and testosterone are out of balance, you're never going to win that battle. It's always going to reset back to that level. So trying to get those in proper balance will do the most, and for most people will actually probably get you to your ideal weight. And testosterone tends to help you maintain lean muscle and avoid the accumulation of abdominal fat. An overabundance of estrogen or estrogen dominance, and that can be either because your estrogen is too high or because your testosterone is too low, or both. But that is what's going to drive, maintaining too much abdominal fat. And so getting that corrected will do the most. And again, for most people, will probably get you to your ideal weight. Certainly, if it doesn't by itself, it will at least achieve that foundation so that if you do anything else on top of that, whether it's dieting or exercise, that's going to be much more effective. And so I think that's the fundamental mistake that people make, and why you see so many diets advertised is people ultimately fail because it's an endocrine problem they haven't addressed properly.
I've been doing a little bit of research on this after, all the weeks of dealing with the show and talking with you about how estrogen in your body for guys is a good thing, but there's something where the estrogen, doesn't it attach to your fat and it's hard to get rid of once it gets in that fat?
Well, it's actually also estrogen can be produced by fat. That's why you have, unfortunately, one of the side effects of estrogen dominant is having, as we would say in men, so-called man boobs. And that's what happens, when people are overweight, that extra fat causes increased production of estrogen. And if you combine that with low testosterone, again, that creates a situation where there's estrogen dominance. And that is going to cause, among other things, the production of man boobs, and again, just cause you to hold on to abdominal fat. So it's more the fat becomes a self-perpetuating thing by increasing the amount of estrogen and again, throwing that estrogen, testosterone out of balance, even further out of balance.
Why is it so important? And I've talked to some of the older guys that are involved with low testosterone, and they go, hey, I really don't need any testosterone. I'm past my prime, and I just don't need it. Is that true?
No, that's definitely not true. And in fact, about 3 years ago, some researchers discovered that there are testosterone receptors on almost every cell type in the body. So testosterone is doing things that we haven't even yet to discover. But aside from all the sexual issues in terms of helping libido, erectile function, it also helps cardiovascular health. It helps maintain a good glucose metabolism, can prevent the onset of type 2 diabetes. And so in men, it affects mood. Low testosterone tends to cause something we call brain fog, which is sort of confusion with your thinking in men. And so the benefits of testosterone are far-reaching and go far beyond those that we most attribute to in terms of libido and things of that nature. So it's doing a lot of things that again, some of them we're not even aware of yet, but definitely need it in men, and that's whether you're 18 or 80, can make a big difference in your quality of life.
There's a lot of the shops around town that someone will go in and just get a shot, and they'll say, okay, I'll see you in 2 weeks. But at K3 Now, you do a little different. You kind of do a whole workup of lab. If you can explain a little bit about the lab testing that's involved in this prior to it all starts.
Right. Again, these sort of one, trick ponies, if you will, as my grandmother would say, are just working on testosterone. Again, that certainly is a common problem in men, but we start with a much more comprehensive approach, and that is really doing a comprehensive assessment where patients fill out, what symptoms they're having, how much stress they have in their life, what their energy level is. And by doing that detailed analysis, then we order a panel of labs that's sort of tailored to what their concerns or what their complaints are. And obviously we're looking for a correlation. And again, the testosterone is just one part of the much larger endocrine system, which also involves your adrenal glands, which control your stress hormones. It includes your thyroid gland, which is in your neck, which controls your metabolism and your heat and cold tolerance. And so the endocrine system as a whole, again, needs to be looked at. And really, we're looking, again, for a correlation. And 95% of the time, we find a correlation, meaning we find lab abnormalities that explain exactly what the patient's concerns are or what their complaints are. And the 5% of the time we don't, it's probably because we haven't done extensive enough labs, and we do a little bit more digging, and the other 5% we typically then, and those people also find, an explanation for what symptoms they're experiencing.
So if we have a guy out there listening right now, what would you advise him if he's a little slow, sitting on the couch a little bit more than usual, and his libido, for lack of better words, is not working as well as it did? What would be the first steps?
The first steps would be to, check out our website. There's lots of excellent information there, and, to become informed. And the first step is really, filling out our questionnaire and let us review it and sort of make some recommendations. And, if you wanted to keep it simple and as cost efficient as possible, just checking your testosterone, can cost about $40 to get the most basic labs, which is, very not very expensive, and at least get your number, and then you would know. If somehow, you thought you were feeling those things and your testosterone level comes back okay, then, it's probably something else that probably should be worked up, but, that might, put your mind at ease. But probably 9 times out of 10, because in men, our testosterone levels tend to drop about 150 points a decade. And again, there's no reason to sort of accept that. So the majority of men are going to see their testosterone level as being low. And now you have an explanation for some of the symptoms you've been experiencing. And again, oftentimes some of the symptoms that we're experiencing we don't even realize because we've sort of been, ingrained to think, well, getting old has some things that come along with it, and some things are just sort of accepted. And people don't even realize that those things don't have to be accepted, that they could easily be fixed, and your quality of life could be, easily improved.
Well, we just have less than a minute. Dr. Robert Kowalski from K3NowMD.com. And if you guys are out there listening and you liked what you heard, the only thing I can advise you is as quick as you can, pull up the website, K3NowMD.com. There is a ton of information on there that can help you out. And you are located at 603 South Boulevard in Tampa. It's pretty easy, right off Platt Street there. Is that correct?
Yeah, correct. Right up, right just before you would get to Bayshore Boulevard, right in, Old Hyde Park. Very convenient. And again, there's lots of ways for people to reach us. Certainly, we love when patients come in the office. We're very proud of the office. But also, if people want to, talk to us online or chat or email, we'll get that information to them, however, whatever format that they feel comfortable with, and we'll get it to them.
Dr. Robert Kowalski, we are out of time, and as usual, a lot of information in a short period of time. We thank you very much, and we will see you again on our K3NowMD.com weekly update.